Welcome to My Dental Key and International Implant Institute's video covering the procedure for socket grafting. In this video, we will demonstrate the socket grafting procedure following the extraction of tooth number 19. The goal of socket grafting is to minimize external resorption and promote bone remodeling and formation. This procedure prepares the extraction site for future implants, improving both restorative and aesthetic outcomes. First, assemble the armamentarium as shown in this illustration. Open a clean, sterile saline solution and sterile water and pour the solution into a sterilized bowl. Using a monoject syringe, draw up the solution for subsequent irrigation. Open the package of the selected graft material and subsequently the sterile container. In a clinical setting, change your gloves after opening the package or have an ungloved assistant open the packaging. Using a monoject syringe, hydrate the graft material by injecting the sterile saline solution into the container with the graft material until it is fully saturated. As a tip, after immersing the graft material in sterile saline solution, remove the excess solution by placing the edge of a sterile 2x2 gauze into the solution. In a clinical setting, retract the cheek and tongue as relevant to visualize the area of interest. Using a monoject syringe, thoroughly flush the extraction socket with saline or sterile water to clean the extraction site and help visualize the granulation tissue. In a clinical setting, it's important to have your assistant ready with the surgical suction during irrigation to capture saline and debris, keep the site clean, and maintain visibility throughout the procedure. Use the surgical curette and gently curette the socket walls to remove residual granulation tissue or infected bone. As a tip, insert the tip of the curette into the deepest portion of the socket and apply gentle pressure as you glide up towards the crustal bone. Continue this motion circumferentially in the socket. Remember that granulation tissue and infected bone will feel tactically different than healthy alveolar bone, which is hard relative to soft tissue and infected bone. Scoop the hydrated graft material using the curette or spatula. As a tip, use your non-dominant hand, or ideally with the help of your assistant, position the graft material near their socket. As an option, you can use your dominant hand to hold the graft packer and stabilize the material during loading. Use the graft packer to gently insert the graft material into the socket. Orient the instrument perpendicular to the socket walls and apply even pressure to fill the socket, slightly overfilling the crustal bone height. Fill the socket in increments using the surgical curette or spatula. Some of the graft material might wash away from the site, so it's a good idea to slightly overfill the socket to make sure enough material stays in place. As a tip, you can rotate the instrument gently to adapt the graft material to the socket's contours. In a clinical setting, between adding and packing more graft material, use a 2x2 dry gauze to gently compress the area. This helps ensure the graft material is securely packed while also keeping the extraction site clean of excess fluid. Next, use the scissors to prepare the membrane by trimming it to match the dimensions of the socket. Use a sterile paper enclosed with the membrane to identify the appropriate dimensions of the membrane. Place the cut, sterile paper in the socket and press to transfer the heme to the paper. In doing this will provide a guide for the dimensions of the socket. Once satisfied with the dimensions of the sterile paper, cut the membrane by laying the trimmed paper over the top of the membrane and trimming the membrane to match. Ensure you have identified the active side of the membrane prior to trimming, according to the manufacturer's instructions. Remember that the membrane should constrict mesiodistally and extend slightly beyond the edges of the socket. It will resemble an hourglass or rounded square for posterior teeth or ice cream cone for anterior teeth. As an alternate method to particulate bone grafting, use a collagen plug as a bone grafting scaffold. Open a sterile package of collagen plug and cut a portion of the plug to fit the depth of the socket. Using cotton pliers, place the plug in the socket, then gently use the plugger or other blunt hand instruments to adapt the material into the socket. Using tissue forceps, gently place the trimmed membrane over the graft material with the active side of the membrane facing down into the socket. Ensure it extends slightly beyond the edges of the socket. Gently pull the gingival flaps over the membrane using tissue forceps, or tuck the external boundaries of the membrane under the flap boundaries. As a tip, you can use a blunt hand instrument and have your assistant stabilize the membrane while inverting the external boundaries to avoid dislodgement of the membrane. Using a needle holder, place a figure 8 or mattress suture to secure the gingival tissue. For more details on how to perform this step, refer to My Dental Key suturing modules. Ensure appropriate hemostasis with gentle pressure with a moistened sterile gauze. After completing the procedure, dispose of all sharps and biohazard waste appropriately. Examine and evaluate the completed socket graft. Refer to this checklist to guide your evaluation of the procedure. Thanks for learning with us.